what we're seeing is a tremendous shift. We see a tidal wave coming at us, and we're scrambling to try to prepare for it as much as possible.
The rate of patients who cannot breathe is overwhelming. You see them over and over again. You're intubating 2 patients in an hour. This is not what we do in emergency medicine, even in the busiest of ERs.
Here in New York City, coronavirus has largely taken over a lot of what we do on a daily basis. It's impacting our staff.
We're seeing a lot of nurses getting sick, incredibly sick.
We are seeing scores of healthcare workers in my own department, get infected, and that's true everywhere.
I know we've all heard of the nurse that passed away recently from the COVID virus. I'm aware of another 40-year-old, otherwise healthy male nurse who's in an ICU and intubated. We don't feel safe.
If patients cough, it's all in your hair. I'm not feet away from them. I am 2 inches from their face. So I have COVID in my hair, I have COVID on my face.
We're dealing with an overwhelming need for PPE in a way that's unprecedented, right? So if we looked at like Italy and China, what they tell us to do, which is to gown up for every patient, make sure there are no breaches, even use a buddy to make sure that you're well protected. It's just not our capacity right now anywhere in America.
Some are given 1 N95 respirator per week. They are not meant to be reused. We're trying to find ways to reuse them because the supply chain is short. People are, baking them to try to kill virus. They're subjecting them to UV light.
The federal government started making suggestions about how to protect yourself with no mask, like using a bandana, right? Which is an absurd suggestion. It's not protective. It doesn't do what it needs to do. It puts medical workers at risk.
Really, I'm calling on all hospitals. I'm begging them to do more. And to the CDC, please reconsider what you are telling us because it's costing people's lives.
Places are running out of ventilators. There's shortages of masks. The disconnect between what you might be hearing at a press briefing and what I'm hearing at sign-out every single day in the emergency department, that chasm couldn't be wider.
I don't believe you need 40,000 or 30,000 ventilators. You go into major hospitals sometimes, they'll have 2 ventilators.
We're delivering millions and millions of different products, and all we do is hear that, can you get some more? Well, it's not. I don't think it's hoarding. I think it's maybe worse.
We need the tools and the resources to do our jobs, and we don't have them.
We're going to need billions of masks across America.
We need some help, and we need it right now.
Everyone is scared. It's a lot harder to save your patients' lives when you're also having to save your own.
I feel like we've been at war for 2 years, and we've just started with this epidemic.
We're going to have an entire healthcare workforce that is going to have gone to war. And so the thing I think about at night now is how to deal with that in the moment, to know that the decisions that we're going to be forced to make are decisions being forced upon us.
Don't make the plan B the plan A and say that that's the best standard. Not while my colleagues are getting sick. It really makes me angry. It makes me feel like, are we forgotten?
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.